Good day, everyone. We are Group 2 with members ARDE, CALANOG, GABAY, GUARDIAN, LIBUNA, MANGABA, and VILLAVERDE. In this video, we will be presenting our assigned question in the Ethical, Social, and Organizational Issues case discussion.
In 2025, the UP College of Dentistry has already adopted and is in the process of implementing an electronic health record or EHR system to store patient information digitally and facilitate referral among the clinical sections. However, for existing members with no technical skills yet to utilize the system, the students are urged to first fill out the old paper-based records instead, and then to simply transfer it to the digital database later on. Some complain that the digital system is difficult to use and is not making their work easier, which has even resulted in minor arguments between students and personnel. However, with some assurance, the college did make a promise that it will get better. A patient, under the alias Miss A, then came to the UPCD clinics seeking dental treatment. The patient was informed of the new system and was made to sign a consent form by a non-academic staff member, Mr. D. The consent form also contained a clause which asked if the patient is willing to have her information used for research should the need arise. During patient workup by the assigned clinician, Mrs. C, the patient disclosed that she has HIV. This was noted and recorded on the paper record. However, during the data transfer process into the EHR system, the clinician placed the record lying face up in the oral diagnosis desk, among which other patients are present. Incidentally, an equation of the patient, under the alias Mr. B, came into the room and saw the name on the chart, and to his surprise, found out about the person's HIV. Without ill intent, Mr. B then let some of his close friends know. This led to the circulation of a post on social media about the patient's HIV status, causing distress for the patient that her secret was revealed, and came to the conclusion that the only place where she disclosed this information was at the UPCD. The patient then decided to file for a case against the UPCD for breach of security and confidentiality. She also denies consenting to having her personal information converted into a digital format. When the consent forms with her signature were presented, she says that their contents were not properly explained to her and felt as if she didn't have a choice during that time.
Our assigned questions are: what ethical issues can be identified in this scenario and to explain them, and what should have been done to prevent them? Now, let's explain what ethical issues can be identified in this scenario. The ancient Greek text, the Hippocratic Oath, is a foundational ethical framework which establishes the ethical principles for the medical profession and serves as a pledge to practice the field with justice and morality. In dentistry, this oath sets forth the code of ethics, guiding dental professionals to perform their duties fairly and with integrity. The following are the ethical issues identified in the given case study: overseen rule of confidentiality, lack of communication and consent, and patient dignity and emotional harm. The oath specifies the principles on the rule of confidentiality, a fundamental ethical principle in healthcare. This was violated the moment the clinician, Miss C, left the patient's paper record face up, allowing others to view sensitive medical information such as the patient's HIV status. The oath depicts an ideal model for physician-patient communication and obtaining consent, with one of the earliest aphorisms stating, quote, "The physician must not only fulfill his responsibilities, but also ensure the patient's cooperation." In this context, the case of patient Miss A raises concerns about the informed consent process, as she claims that the consent form, particularly the clause about the use of her information for research and digital conversion, was not fully explained to her. This highlights issues with the adequacy and transparency of the consent process, emphasizing the need for patients to thoroughly understand what they are agreeing to. The public disclosure of Miss A's HIV status caused severe emotional harm and social stigma. The ethical principle of non-maleficence, or do no harm, was violated, as this breach led to real harm to the patient's mental and social well-being. It is the responsibility of the clinician to act for the benefit of the patient, preventing harm and removing conditions that will cause harm.
Moving on, what should have been done to prevent these issues? To prevent future errors, the college should implement comprehensive, continuous training programs for all faculty, students, and non-academic staff, focusing on the proper use of the EHR system and the importance of data security. The training should also cover ethical responsibilities regarding confidentiality. In addition, regular workshops and refresher courses can ensure the staff are confident and capable of using the system without compromising patient information. The consent process should be transparent and patient-centered. Each patient must be given adequate time to review, ask questions, and fully understand what they are agreeing to. There should be separate consent forms for different aspects, such as research participation and the use of digital records, and these forms should be available in plain language. The clinic should enforce stricter protocols for handling sensitive information, such as immediately transferring paper records into digital format and securely storing any physical documents, ensuring that the records are always face down and that only authorized personnel can access them would prevent accidental disclosure. The use of both paper and digital records increases the risk of errors. To prevent this, the college should establish a clear segregation protocol where physical records are handled with the utmost care and digital transfers are made immediately. Automated systems could be used to ensure data is uploaded directly to the EHR, reducing manual entry errors and enhancing security. A strict workflow should be in place to prevent sensitive data from being left unattended.
To summarize, there are three main ethical issues identified in the given case study, namely the rule of confidentiality, lack of communication and consent, and patient dignity and emotional harm. These issues could be prevented from happening in the future by improving the training of all the constituents of the college, providing a clear and comprehensive consent process, administering strict data protection protocols, and developing a segregation protocol or an automated system. As future healthcare professionals, we will take an oath to first do no harm, and harm comes in many ways, including the breach of our patients' information. Hence, it is our responsibility to keep these pieces of information confidential and protect our patients. That marks the end of our presentation. Thank you.